Hey everybody, welcome to Pack 554's virtual campout. I bet you're all having a great time. I know we got some great things for you, some awesome videos that our parents have gotten together. Today we're going to do a little bit of talking about first aid. Today's video is going to cover the requirements for the Weeblo's first responder adventure. So all you Weeblos out there should be able to get that knocked off today. So first of all, let's talk about what first aid is. And Easton, can you tell them what first aid is?
First aid is caring for injured or ill people until they can receive professional medical care.
Until they can get professional medical care. That's care from an EMT, a paramedic, a doctor, but there are some things that you can do before they get there, and we're going to go over those today. So, let's talk about what we as scouts can do after an accident. Now, the first thing we can do is check. We need to do is check to make sure that everything is safe. And what I mean by that is, say you and your buddy are walking along and he slides down a creek, 15 feet down into a creek. It's not safe for you to go down there, because now you may put yourself in a position where you may need first aid. So you don't want to do something to help somebody that puts you in danger. You want to make sure that it's safe to treat that person. The next thing you're going to do is you're going to calm down and you're going to think. You're going to look at what the situation is and you're going to decide what needs to be done. Now I know in an emergency it's tough to be calm, but it's very important that you do your best, because that way you will be able to make the best decisions and it'll help the victim stay calm knowing that you're calm. Now the next thing we need to do is call. Who are we going to call, Mila?
911.
We're going to call 911. If the person seems badly hurt, we're going to get that help going to come take care of whatever the issue may be. And the last thing is we need to care. We need to explain to the person that you know first aid and you're there to help them. So you're going to come up and say, Easton, I know first aid. I'm going to help you out, okay? And you're going to get that person's permission to treat them. You're not going to just come up and start working on them. You need to make sure it's okay with them for you to treat them. Okay? So, when we call 911, we talk about 3 W's that you need to know. The first one is who you are. Who are you? Mila, right? Okay. The second one is what the situation is. Is there an accident? Is there a fire? What do people need? What are their injuries? You need to be able to tell that to the person on the other end of the phone. And the third thing you need to know is where you're at. Either an address, or an intersection of 2 roads, or you're hiking on the Bald Eagle Trail and you're down by the waterfall. You need to be able to tell that person the best of your ability where you're at so they can get you as quickly as possible. And the last thing you want to do is never hang up until the person on the other end tells you it's okay to do so. They may need more information from you, and they may need to keep you on that phone until they can figure out what the situation is. Now, one of the first things I like to have when I go out camping or hiking or anytime I'm out in the woods or wherever I may be is our first aid kit. This is my first aid kit here. Now, let's go over a little what's inside of my first aid kit. Okay, here's my first aid kit. And these are some of the things I like to carry around in my first aid kit. First thing I have here is some antiseptic wipes. And what those are going to do is help clean out any cuts or scratches that somebody may have to keep it clean, keep it from getting infected. The next thing I have here are these little antibiotic pouches. And then we're going to put those on any cuts or wounds that we have to help keep them clean. So once we clean them, we're going to put those on them. I also have some gloves, a pair of tweezers. I have various sized gauze pads and bandages here. Some roller gauze. I have an ice pack. I have an iPad if I need one. I have regular plain old Band-Aids. I have some butterfly Band-Aids, which are a special kind of Band-Aid that help close a little bit bigger cuts if you have one. I have a triangular bandage. I have a pair of scissors. I have some tape. I also have something that's very important when we go hiking. That's some moleskin. We can put that on blisters and help relieve some of the pain for our blisters. And another thing I like to carry as a grown-up is some aspirin. Now, younger scouts their parents may not want them carrying aspirin because it's medicine, but adults it's more okay to carry for their purposes. So now, let's learn how to use some of these things that we have. So Easton was climbing his favorite tree here, and he seemed to scratch his arm a little bit. So we need to take care of a cut on his arm. So first thing we do is, again, Easton, can I fix your arm? Can I take care of your cut? Okay. So one thing we want to say, if bleeding is really severe, we need to call for help. And how do we do that?
Call 911.
Call 911, right. But our bleeding here doesn't seem too severe, so we're going to take care of this. Now it's really important that you keep the cut clean so it doesn't get infected. So what we want to do is use direct pressure. And we're going to take our gauze pad, we're going to put it right over the cut, and we're going to hold it there. And we're going to hold it until it stops bleeding. Okay? Now, if it happens to bleed through our gauze pad, we simply want to take another one and place it on top of this. And we're going to keep doing that until it stops bleeding. Okay? So, we got our gauze pad on his cut, and we're looking, and it stops bleeding. So we want to clean it up here so it doesn't get infected. We're going to take our little antiseptic pad here, and we're going to clean it off. Okay? And we're going to take a little bit of cream, and we're going to put it right on his cut here. So I'm going to rub that cream around. Okay. And we're going to use our gauze pad here, which isn't too clean now, but we're going to use our gauze pad, put it on, and we'll wrap it up real nice for him to keep it clean. And that's how we handle cuts and scrapes.
Ow!
Okay, now Easton has burnt his hand touching a hot fire pit. So what he has some burns on his hand. So how we're going to treat that is, we're going to take a hose here, and we are going to run his hand under cold water. Okay, we're going to run that under cold water for at least 10 minutes. Okay, and longer if we need to. We're going to keep going until the burning goes away. Okay, we're going to keep that under there for 10 minutes. Now once the 10 minutes is up and the burning has gone away, we're going to take a clean roll of gauze, and we are going to loosely wrap this. We don't want to tightly wrap it. We want to loosely wrap it up. And what that's going to do is prevent that burn from getting infected. Now an important thing to know is if this burn gets really bad and starts turning black on him, he needs to go to a doctor immediately and have this treated. Okay? So that's how we treat one of our friends if they were to get burned. Easton now has a nosebleed. That tree really beat him up pretty good, and he's got a bloody nose. So how do we want to treat this bloody nose? Well, the first thing we're going to do is have him lean his head forward, and that keeps the blood from going down the back of his throat and out through his nose instead. So let's lean our head forward, okay? And he's going to grab the soft part of his nose here, and he's going to pinch that, okay? We're going to do that for about 10 to 15 minutes to get it. If it doesn't stop after 10 to 15 minutes, we need to call for help because he's got something more serious going on than just a nosebleed, and it needs to be handled by a professional. Another thing you can do for a nosebleed is take one of our ice packs here, and we can put this on his nose, and that will help stop it from bleeding. So again, for a nosebleed, we want to put our head forward, pinch our nose, put an ice pack on it, and if it lasts for more than 10 to 15 minutes, we need to get some more help. So Easton went for a walk with his buddy in the woods today, and when they came out, he found he had a tick on his arm. So what do we want to do when we find ticks? Well, we want to tell an adult. Tell an adult, I got a tick on my arm, and let them take care of it. Now what an adult's going to do is they're going to grab a pair of tweezers here, okay? And they're going to get the tick as close to the skin as they possibly can. And they're going to grab it, and they're going to pull lightly and gently straight out. You don't want to twist it. You don't want to yank it. You want to go as lightly and gently as you possibly can out. If you go fast and you twist it, you could end up leaving part of the tick in the skin, and that's not good. So once the tick is out of Easton's arm, we're going to take some warm water and some soap, and we're going to wash his arm where the tick was. Okay, get it real good, wash it up with some soap and water, and go ahead and rinse that off. Okay, and we're going to take some antibiotic ointment, and we are going to put that on Easton's arm here. So we're going to put it on where the tick was, rub it in. Now, one important thing with the tick bite is you want to make sure he doesn't develop a rash. If Easton gets a rash where that tick was, you need to get him to a doctor as soon as you can, because it could be something very serious. We're up here and it's magically turned winter up here in Buffalo. And Easton has spent his day outside playing, and he's been out there having fun, but just a little bit too long because he now has frostbite on his feet. So, how do we know it's frostbite? Well, first it kind of turns some colors here, and then it turns to like a grayish skin with some white patches on it, and eventually the pain he's feeling will go away and his feet will feel numb. That's a pretty severe case of frostbite. So how do we treat frostbite? Well, the first thing we're going to do is we're going to put some warm skin around the affected area. And the way Easton can do that here is simply by holding it with his hand there. And what that's going to do is start to warm his skin up and get the blood flowing a little bit in there. Another thing we can do is run it under cold water. You don't want to use warm or hot water, cold water. And as you run in the cold water on it, you can gradually make it warmer and warmer and warmer, but you don't want to go too quick. You want to go real slow with that. Now, one thing you don't want to do for frostbite is you don't want to rub the skin that's affected by the frostbite. No, you don't want to rub the skin. You just want to hold it, okay? Now, the next thing you want to do is get to the doctor. You got to have the doctor treat this. So, again, for frostbite, you want to hold warm skin against it, run it under some cold water, gradually increase the water to warm water, and then get to a doctor. So those are some very simple first aid skills that our Cub Scouts can perform. Now we're going to move on to a little more advanced things, and these are called our 5 hurry cases. These are serious issues that are very life-threatening. So what's the first thing we need to do if we have one of these 5 hurry cases?
Call 911.
Call 911. Very good. That is very important to get help going in these cases. So let's go into our 5 hurry cases. Now Easton is continuing his day up in the tree, and he's decided he just didn't like that tree branch. So he got out the old chainsaw and tried cutting it down. As you can see, he got his leg instead. This is one of our 5 hurry cases. As you can see, the blood, he's bleeding severely. Okay, quite often you may have spurting blood here. If you have gloves and goggles in your first aid kit, you definitely want to put them on for this. So, what's the first thing we're going to do, Mila? Go call 911. This is a true emergency, so if you don't have your first aid kit on you, you can actually take the shirt right off your back, ball it up, put it on there. Hold it on tight. You want to get that real tight. You want that bleeding to stop. If this bleeding doesn't stop, it truly is a life or death situation. Another thing you can do is raise his leg up. Elevating his leg will help stop the bleeding. Okay, so you're going to hold that there for as long as you need to hold it there to get that bleeding to stop. If the blood starts to come through your shirt, you can use something else. You can use Easton's shirt. You can use, maybe by then your first aid kit would be here. You can find something in there, a nice gauze bandage like this one. You're going to keep covering that up, and you keep holding it till it's done, till it stops bleeding. As much pressure as you can. Once it's stopped, you want to take your gauze and wrap it around. Keep going and so you can hold that all in place. You don't want to take anything that you put over that wound off of that wound. Leave that up to the doctors at the hospital to do. And that is how you handle severe bleeding. Before we begin, I do want to caution you, do not practice this on people, your friends, your parents, your dogs, your cats, anything living. Do not practice this on. As you can see, I'm not actually going to show you this on Easton. I'm just going to describe the steps. It's very important. You can really seriously hurt somebody if you decide that you're going to practice this on them. So, now Easton's out. He was having pain in his chest and he fell down and now he's out unconscious. So what's the first thing we do? Call 911. The next thing we're going to do is we're going to shake him. Hey, are you okay? Are you okay? If he doesn't answer, he might not be okay. This is his favorite place to sleep, but he's not sleeping this time. So we're going to go like this. We're going to tilt his head. We're going to feel here to see if he has a pulse. Okay? We're also going to be looking and feeling if he's breathing. If we can't see his chest rise or hear him breathing, then we need to take action quickly. Now the first thing we're going to do, okay, is we're going to feel here, and we're going to put our hands in the middle of his chest, okay, and we're going to push hard. We're going to push down hard on his chest, okay, and we're going to do that 30 times, okay. Once we get done with 30 times, if you have a handy dandy pocket mask, what you can do is place that over his face and blow into it. You want to tilt his head back and blow and try to get that air into his lungs. You're going to do that 2 times, okay? After that, we're going to put our hands back on his chest and we're going to start pumping away 30 more times. So once we've done our 30 times, we're going to give him 2 more breaths. We're going to continue this until one of 3 things happens. The first thing is he starts to get a pulse again. Once he starts to get a pulse, we're going to stop. We're going to make sure that he's still breathing. If he's not breathing, we can still give him breath. If he starts breathing, we're just going to continue to watch him. The second thing that can happen that we stop is professional help. An adult, a doctor, a paramedic shows up and takes over for us. At that point, we can stop. The third time we're going to stop is when we are just too tired and we cannot do it anymore. So now what if we come across someone laying down, such as Easton was? If he has a pulse and he's not breathing, what do we do then? Well, get out our handy pocket mask, if we have one. If not, we can use mouth-to-mouth by simply placing some sort of barrier over the person's mouth. It can be your shirt, anything you can find, and blowing into their mouth to make sure that air gets into their lungs. And we want to do that at a rate of about once every 6 to 10 seconds. So you want to give a breath. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000. And you're going to continue to do that until, again, either professional help arrives or the person starts breathing again. Easton, are you okay? Are you okay? Are you choking? Mila, call 911. Okay, Easton is now choking on a chip. So what we want to do here is he's coughing and he's breathing now. So we want to encourage him to keep trying to get that chip out. And as long as he can breathe and cough, that's what we want to do. Okay? Now if Easton stops breathing, what we want to do is we want to stand him up. Okay? We want to hit his back 5 times as hard as you can. Hopefully that'll clear out whatever he's choking on. If it doesn't, we want to come around. We're going to make a fist with our palm of our hand. We're going to put it up under his belly button, and we're going to pull up 5 times as hard as we can. Okay? Hopefully that'll clear whatever's in his throat. If it doesn't, we want to keep going back and forth, hitting him 5 times as hard as we can on his back, coming around and pushing up. Now when you get up under here, you want to push in and up 5 times as hard as you can until that object comes out and he can breathe again. Okay? Now I do want to caution you again, like the CPR, you do not want to practice this on a person. Another one of our 5 hurry cases is known as a stroke. Now while there's not a lot you can do for a stroke, it's important to be able to recognize the signs of a stroke. Now, because a stroke is one of our hurry cases, what do we want to do, Mila? Call 911. That is the most important thing that you could do if somebody's having a stroke. Now what is a stroke? Well, a stroke occurs when the blood supply to the brain is cut off. And what that can do is cause brain damage and death, and it can do it quite quickly. So speed is of the most importance here. So how do we recognize that somebody's having a stroke? Well, there's a few key signs that you might want to look for. The first one is going to be numbness or weakness in the person's face. Oftentimes their face will droop a little bit, their eyes may droop a little bit. That's a pretty good sign that someone may be having a stroke. The next thing is trouble with walking or speaking or understanding or seeing. Definitely a sign someone may be having a stroke and you want to get 911 as quick as you can. A couple other things are dizziness and headache. They also may be a sign of a stroke, so you want to keep an eye out for that. A good way to remember the signs of a stroke is by thinking of the word FAST, F-A-S-T. That stands for face drooping, stands for arm weakness, speech difficulty, and the T stands for that is time to call for help. What's that number again?
911.
Perfect. Now we're going to talk about some poisoning. Poisoning can be caused by many things, including eating various berries or plants. It can be caused by
Swimming pool chlorine.
swimming pool, breathing in swimming pool chlorine. It can be caused by getting bit by a snake or an insect. It also could be caused by taking too much medicine or the wrong kind of medicine. Many different ways you can get poisoned. It's important to know though, if somebody does get poisoned, what should we do? Call 911. She is my little expert on 911. There's also another number you can call. It's called the Poison Control Center. And the number's a little tricky to remember, so you might want to write it down. It's 1-800-222-1222. And they are very good at giving you directions on what to do, but you need to know a couple things. You need to know what type of poison the person may have taken. Okay, you need to know how old they are. And they will give you directions on how to treat it. But you also want to get 911 going. So that's the first important thing, is to call 911 and call 1-800-222-1222, and they will give you directions on how you need to treat that person. So the last thing we're going to talk today about is shock. Now what is shock? Well, shock happens when a person loses a good amount of blood. It's your body's defense to protect the vital organs from that blood loss. That's pretty much it basically. What you need to know is how to treat it. Now, anytime you have major bleeding, suspect that the person's going to be in shock. Like when Easton cut his leg with the chainsaw, he's probably going into shock. So, the first thing we're going to do is, Mila, call 911. Go call 911. Okay? The next thing we want to do is cover him up with a blanket. Now I have his favorite Minnie Mouse blanket here, so he ought to like this. But we want to cover him up because when you're bleeding, you're also losing body heat. With that blood loss, you lose heat. So we're going to keep him up, keep him nice and warm. Next thing we're going to do is we're going to elevate his feet. What that means is we're going to put something on there and we're going to lift it. And that's going to allow the blood to flow down into where his important organs are, his lungs, his heart, all the important things. So that's what we do for shock. We want to call 911, we want to cover him up to keep him warm, and we want to elevate his feet. We also want to keep checking to make sure that the bleeding is stopped or whatever his issue is until help arrives. So that concludes the Weeblo's first responder requirements and our first aid for Cub Scouts. I encourage you to keep up to date, keep practice on what to do in these situations. That way, if they ever do occur, you guys know what to do and you can know how to handle it. I'd like to thank Easton and Mila for their help today. They did an awesome job. And I hope you guys had a great time. I hope you're having a lot of fun with our virtual camp out. I look forward to seeing you guys at the closing ceremonies. Have an awesome day.